Good evening, everybody. Thanks all for coming. I am really excited to present this to you. For the most important thing that I'm going to do tonight is to make you guys think. I want to make you guys think about what you think of your bodies, what you think about chiropractic, and I want to kind of expand some of your thought processes. Because one of the things that I've found over the course of the 20-something years having practice is that a lot of people have very limited concepts of what they think chiropractic is, and very limited concept of what they think their bodies are capable of. First thing, though, is we've got to talk about the problem. The problem is that we are one of the sickest countries in the world. So in 1990, as an example, they did a study and they ranked us number 28th in the world in like the top 50 countries, which is pretty awful, actually. And we had the dubious honor, though, of being number one in spending. So we're spending $900 billion a year to be 28th in the world. So then they redid the study in 1999, and they said we're 37th in the world, but by that time we're spending $1 trillion. So we went from being 28th, and we dropped 9 places, and we spent $100 billion more to drop. Now that's not a good track record, right? In 2010, the complete numbers haven't come out yet because they're still working on it, but my estimate will be 45th in the world, and when I wrote this slide last year, it was 1.5 trillion. We've already passed $2 trillion. We're beyond $2 trillion a year on our supposed health care. So what does this show you? If we're 45th in the world and we're spending $2 trillion, what does that show us?
It's not working.
That's right. That's right, Aisha. It's not working. You know this? Like when you're driving onto the highway and you see the sign for the drunk driver that says "wrong way, go back." That's what this is. This is wrong way, go back. We're spending more money, getting sicker, right? So something's got to give. We're going the completely wrong direction. And like if we were Coca-Cola, right, and we were having like a board meeting and I was the president and I was saying, okay guys, big problem here, we're spending more money on advertising but we're actually getting less and less market share and we're getting worse. What would they do to me? They'd fire me. They'd fire me, they'd fire all of us probably, the whole board would be fired, and they'd have a whole new board and completely redesign what's going on. But instead what they're doing here in this country, like with Obamacare, is that they decide that we're going to make it even worse because we're going to focus on the wrong thing, who's paying for it. Do you think that's a problem? The problem who pays for the insurance, or who pays for our health care? No. The problem is what they're paying for. Not who's paying for it, but what they're paying for. This is the biggest problem with this country, I believe. If we could change this word, these two words here, feeling good is not health. Feeling good is not health. And this is, if you know nothing or remember nothing about what we talked about tonight, I want you to remember that. Feeling good does not equal health. Because this is what we think. Feeling good when I wake up in the morning, right? And I'm not hurting, oh, I must be healthy. But let's take two scenarios, okay? Let's say we went to some restaurant tonight, not Paper Mill Grill, because this would never happen there. But let's say we went to Paper Mill Grill, some other restaurant, and we all got sick from the food, right? It was tainted with something, we all got salmonella, you know, undercooked chicken or vegetables, whatever. And so we all start throwing up. Now, if you're throwing up, are you sick?
Yeah.
It's a trick question. So, but well, you're getting sick, right? But is it a sick thing to throw up bad food?
No.
No, it's actually a good thing, isn't it? Because if you didn't throw up the salmonella, what would happen? Then you get really sick, right? Then you get typhoid and all kinds of stuff like that. That's really bad. So when you're throwing up the bad food, you look sick, but you're really what? Healthy. Because it's a healthy response. Your body's getting rid of something that's not supposed to be in there, right? Make sense? Now, on the other hand, let's say someone got forbidden cancer growing in their body, but they haven't found it yet. But they feel good, right? So you got that person there who feels good, but he's got a tumor growing in his lungs or his heart or prostate or wherever. Is that person healthy? But they look healthy, and they act and they feel healthy, right? So you see the mistake of feeling good equaling health? Because you can have cancer in your body and think you're feeling good, but you're really sick. And on the other hand, you could be thinking you're sick because you're throwing up the bad food, but you're really healthy, right? So it's completely reverse of what the way modern America has us thinking, has us trained. And then, of course, we've heard this story, right? He wasn't sick a day in his life, and then what?
He died.
He died of what?
Heart attack.
That's right, heart attack. Have you all heard that story? The guy was totally healthy, never a sick day in his life, and all of a sudden he's dead, right? Happened, the patient told me about this a couple weeks ago, where one of his next door neighbors was prime of his life, and he was doing great, and he just went out, played tennis, and he was fantastic, and he came back in the house, and bam, and the guy was 40-something years old. So, let me ask you this, was that guy healthy?
No.
No, right? So you could say, I feel healthy, I'm 40 years old, I just went out and played tennis. But here's the thing. What symptoms was he covering up with medications or was he ignoring, right? So as an example, someone who has a heart attack, what's a very common symptom someone has with a heart attack?
High blood pressure.
High blood pressure is a common thing. And how might someone feel high blood pressure, do you know?
Lightheadedness?
Yeah, lightheadedness or headaches. But what is he doing instead of going to the doctor for? What might he have been doing if he had headaches or something?
Advil.
Yeah, I'll just pop some pills, make it go away. And so another thing, what about maybe there was some arm pain, right? Oh, it's just from the backhands, you know, so I'll just take some Aleve, you know, a Tylenol to get rid of that pain. So he's covering this stuff up or ignoring it. Or some people have like this tightness in their chest. But what do? They'll say it's what instead of tightness in my chest?
Indigestion.
Indigestion, right? So what am I doing?
Tums.
I'm taking Tums or Pepsid, right, or Rolaids, or right. So maybe that person could have saved his own life if he'd only paid attention. So here's the next thing that I think is really, really important. I already taught you that feeling good does not equal health, right? Here's the next thing that's really, really important. Symptoms are blessings. All right? I want you to remember that for the rest of your life. This is so important. Symptoms are blessings. Example. Let's say we had a little kid, like one of these gorgeous little kids running around here, and there was a hot stove right there. And they put their hand on a hot stove. What would you want to happen? Right. And then what would they do?
Sorry.
But what would they do first? So my hand's on the hot stove, and what are they going to do?
Jump back.
They're going to pull it away, right? So the symptom is what? The symptom is pain, and the pain is, in this case, is this a good thing or a bad thing?
Good.
This is a good thing, because it's telling the little child what?
To get away.
Yeah, get away. You should not put your hand there. Get away from this, right? So symptoms are a good thing. Now, I'm not saying you should be happy with the symptoms. I'm saying, yes, I have symptoms, you know. But what I'm saying is, when a symptom comes your way, what it's telling you is something is wrong. And do something about it. Just like the little child, he's got to do something about it. He's like, oh man, that hurts. I shouldn't put my hand there. Well, when your body gives you a symptom, it's the same thing. You should say, oh man, something's going on. I got to do something about it. So I'm so proud of you guys being here in our office, because this is a great, holistic, healthy way of taking care of things versus the way everybody else is taking care of things. A lot of us don't think about this, but the nerves in our spine, they go to the organs too. They don't just go to the muscles. They go to all the organs, whether it's the immune system or the lungs or the kidneys or the pancreas or the ovaries or whatever it is. They go in all these different places. So what happened with Superman is this. See, he had a fracture. So his brain was going at 100%, as evidenced by the fact that he could, you know, like act and direct and star in films and stuff. But his body, because of that fracture, his body was essentially at 0%. So his body was essentially not able to function the way it's supposed to, because he had a total cutoff between the brain and the body. When I was 5 years old, right after this picture was taken, a couple weeks after this picture was taken, in the summer of whenever it was in the 70s, I started developing asthma and allergies, just like Sammy did. But I was not as fortunate as Sammy, because Sammy found me when he was 3.5 years old. So he only had 3 years of suffering, as horrible as he did. Unfortunately, I went until I was 20 years old. And so from age 5 to age 20, I started popping my pills and getting allergy shots every week and puffing on inhalers and nebulizers. So by the time I'm 20 now, I am shaking like this from the asthma medication, because all the cortisone that's in there, and that's one of the side effects of cortisone, is to make your hands, you know, have tremors. And I'll never forget this. I came home, I was going to Albany State, New York, and I came home to my parents in Long Island, and I said to them one day, after driving the 5 hours or so from Albany back home, without my inhaler, I forgot my inhaler, and I had an attack while I was driving, and I just made it home, like gasping for breath. I said to my parents, finally, when I recovered my breath after taking 20 million puffs from the inhaler, I said, like, okay, I'm 20 years old, and I'm sick all the time. What's going to happen when I'm 40? Right? Where am I going? If this is where I am now, 20 years old, I'm hooked on this inhaler all the time, and by the way, I'm also getting bronchitis like 4 times every winter. I'm on antibiotics like all winter long, and I can't, I have allergies that are constantly killing me. I mean, I'm just sick all the time. I was like a drug factory. I had this thing hanging up in my dorm room that was like a shoe bag, and it was my drug bag. And I was the dorm pharmacist, so that people used to come to me in the dorm because they were sick. I had antibiotics, I had the allergy medicine, I had all this kind of stuff for them, because that's you know how I lived. So I was saying to my parents, like, what is going to happen to me when I'm 40? If I'm this sick at 20, what's going to happen? And they had no answer for me except, I'm sorry, you know, bad roll of the dice or something. Summer '84, a couple of weeks after that particular incident, my mom starts going to a chiropractor for guess what?
Accident.
Well, back pain, actually. But she sits in a talk like this, in the summer of '84, small group, chiropractic, little talk to introduce patients to understanding how strong their bodies are and how amazing chiropractic really is. And she calls me up from the office and says, Drew, you're coming to see this chiropractor next time he does a talk. I'm like, Ma, I don't have back pain. You know, I don't know what you're talking about. She said, Drew, just come. You got nothing to lose, just listen. It's okay. So I went there a few weeks later, little talk like this, but of course my mom had prepped Dr. Sawaki for me, and so he singles me out in the middle of the talk, because he's talking about asthma too, just like I did. And he said, Drew, I hear of asthma and allergies. Is that correct? I said, yeah. He said, well, why do you have asthma and allergies? I'm like, I don't know. He said, well, do we breathe the same air? I'm like, yeah. And he said, well, if we breathe the same air, you and me, how come you have asthma and allergies and I don't? Good question, right? And he said, well, what do you think the problem is, Drew? I said, I think the problem is the pollen, right? It's the pollen, it's the mold, it's the mildew, it's the grass, it's the leaves, it's the rose fever, hay fever, and I just pointed all these things like this. And he said, Drew, okay, let's make believe it's just the pollen. So what that means is that if the pollen is the cause of your asthma, why isn't it the cause of everybody's asthma? So in other words, like if everybody breathed in the same pollen, how come everybody doesn't have asthma? If the pollen's the cause, right? Pollen's the cause, then how come everybody doesn't react the same way you do? And I couldn't answer that. I was like, I don't know. He said, well, what do you think about your health? Like, are you satisfied with the current direction of your health? And I said, no. And he said, well, why do you think you have this asthma then? And I couldn't understand it. I was like, well, I don't get where you're going to. And he said, well, if we can remove these subluxations and allow your lungs to breathe, like he explained, just like I explained, he said he had these like paper things, you know, and now we have PowerPoints. He said, maybe your life can change. And I was like, so you're telling me that by getting adjusted, I might like have improvement in my lungs? And then he said to me this, he said, if you're not satisfied with the current direction of your health, he said, if you keep on doing the same things, you'll keep on getting the same results. Right? Makes sense, right? If you keep on doing the same things, you'll keep on getting the same results. So if you want something different, what do you got to do?
Change.
Something different. And all of a sudden, I thought about that. I'm like, 15 years, I've been doing the same thing. I've been puffing on inhalers. I've been popping pills. I've been getting allergy shots. And nothing's changed. If anything, I've gotten worse in 15 years. So, obviously, if I want to change my direction, if I keep on going in this direction, I'm going to keep on getting the same thing. So I need to change something. So I said, okay, so what should I do? He said, well, let's try chiropractic. Now you can figure out the end of the story. 3 months later, summer of '84, no more asthma. That was my last asthma attack, was the summer of '84. So that's why I am so crazy about chiropractic, because, especially with the kids, because I know the potential that's in them. I know potential is in you.